Hi, and welcome back. This next module is all about shoe inserts. So I'm going to show you the shoe inserts that I utilize and what I want you to look for on any shoe inserts that you currently have to give you a little bit of arch support, or any that you're considering buying. And if you'd like to buy the ones that I'm going to be showing you here, just email us at the email address below. And we can see what we can do to get you a discount for your first pair of these shoe inserts. Now, shoe inserts are great in the fact that they help to give support to the arch, which is what we want, right? We've been talking about that the whole time. Giving support to the arch, getting in a good position, takes stress off of that plantar fascia, and allows all the good things that you're doing for yourself, it allows it to heal faster. But when you get a shoe insert, a lot of times what it can be is not very much arch support at all. Like if you can grab the shoe insert, I'm going to do it on the front here. If you can grab it and you can pull down the arch like this, in this direction, sorry, it's a little dark, that direction, that is a very poor arch, okay? But if you can grab hold of the arch support like it is here, you grab hold of it here and you can't squeeze it, you can't do anything, you can't push it down so that it changes, then you've got a really good or decent arch support there. This is called the Protalis. It's made especially for plantar fasciitis, or it has the cushiony sole here, or excuse me, cushiony heel here, and then the more rigid arch there. So these retail at about $65, and for your first pair, if you purchased it from us, it would be $50. So let us know if you want that. But again, if you have your own pair, just make sure, grab a hold of that arch, and if you can squeeze it down, you know that it's not a great pair. And if you go out to buy any other ones on the market, just make sure you can get your hands on them and squeeze, because think if you can squeeze it with your hand, what's going to happen to it when you stand on it, right? It's not going to give you very much arch support, it's just going to flatten out right again. Now, the next type of arch support that you can get is kind of the next level up in regards to support. It's a custom fit orthotic. So let me just grab that one out of my shoe. So custom fit orthotics look something similar to this, okay? I do mine through Langer, which it's basically old school. They do casting of the foot in a neutral position. What some of them do is put your foot in like some foam. You could be sitting and you're not necessarily in a neutral position, and then they fill in that foam to create an orthotic for you. I haven't found those to be the best for people because unfortunately what happens is, again, you don't get that support in the neutral arch position that you need to take the pressure off the plantar fascia, okay? So what I like about these two is people look at these and go, wow, those are really hard. And they are hard and they last a long time, but it should fit like a glove. It shouldn't feel like you're standing on something hard. You get a little cushion on this area here, and then this part is geared specifically towards what my heel's doing. And each part of this is going to be different, as is this is going to be different as well. So if you're going to somebody who does custom fit orthotics, you want to make sure that it's made of good, solid material. You want to make sure when you get that back and it fits in your shoe, and it could be a full length one. I chose to have half length on mine, but it could be a full length one as well. You want to make sure that it slides right in the shoe, and then when you're wearing it, you feel as though you put on a glove. Like it doesn't feel any real different except for a little bit more support in your shoe, on your foot. So a lot of times they can be made out of cork, which will wear down a lot faster than this harder plastic. But again, if you get somebody who's inexperienced at making the custom fit orthotics and they're using harder plastic, then it can feel uncomfortable in your shoe. I literally put this in my shoe, started walking a couple hours a day, and I didn't have any pain, but my knee pain and back pain went away. That's why I got these orthotics many years ago. These will last anywhere. I'm not a runner at this point, so these are lasting me between 3 and 4 years. Some runners have to redo those every couple of years, but I find these to be really good. So find somebody who does the Langer, or just make sure that it's a good, solid piece of material that you're getting the orthotics made from. And again, it should be made specifically to your foot in a neutral position. This is the outside. This is the inside of that arch. So my arch kind of sits like this in a neutral position, so they maintain that really well for me. If they just took it with me standing or sitting, the arch would be a lot flatter. I wouldn't have any arch support there, or I'd have too much because my foot is more relaxed. So it really needs to be in that what's called a sub-talar neutral position when they're making the orthotic for you to get the best results. Our next module is all about footwear. Each pair of feet are unique, so you want to make sure that you're getting the right pair of shoes for you to support you in your endeavor to get rid of plantar fasciitis.